There you go. Okay, so now that we're recording, welcome everyone. This is September 2022, NGO-CSW's first monthly meeting of the season. We're so excited to be partnering with Fos Feminista, and we thank them for providing interpretation. Everybody settle in, introduce yourselves, and we're going to get started. So my name is Huriga Delekian. If you haven't seen me yet, I'm the chair of NGO-CSW New York. I am very rejuvenated, excited to be working with you all, get ready for CSW 67. I know it's not till March, but as you all know, we start the planning this early. We have done an amazing job. You will hear from our advocacy research group and thank you for all of those who responded to our survey. We heard you, we're listening to you. We are as frustrated as you are with some of the glitches in the virtual platform. We are looking into a new platform. I can't make the announcement yet, but we're very excited that this year will be the best year ever on our virtual platform. We have to believe that, right? Every year we keep trying to improve. So please join us every month. We will have these virtual meetings and we will share with you all our progress on what we're doing, how we're preparing for the monthly meetings. We will definitely create more space to interact and to hear your opinions. We want you to engage with us. I know sometimes these groups are really large, but I really do believe that with patience and understanding, we can definitely listen and hear you, and then you can actually also hear from us what it is that we're preparing. So I will be joining these meetings every month to give you updates. And for now, I just want to say we want to welcome 3 new interns. And every year, as you know, we bring in interns to help us with the preparations. I want to welcome Carla, Michaela, and Ali. So you will definitely be hearing from them when you email info@ngocsw.org. They are starting this week, and then we will be in the office at least a couple of days a week, as much as we can. We are definitely taking precautions as well. I'm sure you all know we have to be careful with the viruses, but we are ready to organize our next forum. Let me see, what else do I have to report to you all? We already have been in touch with the Bureau. As you all know, we were very successful working with the Bureau last year, and we're so happy that 4 out of the 5 Bureau members are the same. We're still waiting to see who's going to be confirmed from Asia Pacific. And they're very open to working with civil society, which means that we're going to build on whatever it is that we started last year. And that should help us in achieving our goals with not only language, but hopefully also pushing our limits on how much more we can get in our agreed conclusions. And as I mentioned earlier, we also have shifted our committees in a way where we're opening it up to hearing from our audience more. You will hear more in a few minutes from our advocacy research group's co-chairs, as you know from the program, and they will tell you more about that. We are also very determined to keep working with our regions. As you all know, NGO-CSW originally has had Geneva and Vienna as a group in Europe, but then we've added Africa, Asia Pacific, Middle East, South America, of course, I can't forget that. And we are determined to be working with our colleagues in those regions and also supporting them in any way we can so that they can reach out to more people and then hear back from them on what it is we can do. How can we bring your voices to the United Nations? If you are new in this meeting, and the ones who have been around for years, you know, our mandate is to bring the voices of women and girls into the United Nations, even if you're not ECOSOC accredited, even if you're not part of an organization that can help you bring your voice we are that organization that can hear almost anyone. So if you are in this meeting and you know people in other regions who have a story, who have information that can help advance gender equality in any way, please bring them on board, sign them up to our email so they can join our meetings. I also want to assure everyone that we want to be as open and inclusive as possible and be respectful of people's differences and abilities, and we want to make sure that all voices are heard. Yes, please mute yourselves as you come in. Makes it much easier for people to hear presenters. All right. I'm going to be checking the chat throughout the meeting. If there's any questions you have, if you need to know anything, I will be interacting with you all throughout the meeting while I'm listening, of course, because I'm very excited with the program that we have. All right, I think I have shared all the information I have, and I'll give back an extra 5 minutes if necessary. That hand it over to Advocacy Research Group. Okay, Devin, I believe you're going to get started with the Advocacy Research Group presentation. And then hopefully everyone will be here. Thank you so much. Okay, I think we're expecting, let me see, is Ivy in?
Yes, Ivy is in.
Okay.
Ivy or Ani, do you want to jump in and start?
Yeah, Ivy, please let me know if you're able to jump in.
I know I finished my presentation quite fast, so we have a few minutes. Surprising you guys with extra few minutes.
For Advocacy Research Group, as some of you might know, and Ivy, please jump in at any time. But what we wanted to do, also team, if you have trouble hearing me, please let me know. I'm currently in Puerto Rico, so might have unstable connection.
You're sounding amazing, and thank you so much for
right.
joining on your vacation, Ani.
No, my pleasure. Would never miss it. Yeah, so super quick update from us, but an important one. We just wanted to let you know that we have done research and had topics and concerns and issues in mind related to CSW 67 priority theme. But what we wanted to do is to get your thoughts and your input on what your concerns are and what you would prioritize moving forward for us to help us move forward and develop our recommendations. For that reason, we went ahead and conducted a survey, and I'll speak a little bit more about the results, but what we want to do today to keep the focus on the important goal, we wanted to present the results today, present what we thought our constituents who submitted the survey thought the important topics were and the major concerns were. We highlighted those topics. I think it's 7 or 8. And what we want you to do today is go in and let us know through a poll, what are your top 5. We'll go to the list and we'll give you some time to read and reflect, and we have a poll to have you choose the top 5. With that said, I can go to the next slide. And Ivy, I see your chat. Did you want to add anything else? I see your comment in the chat. I didn't read that fully.
No, I think it's good. I don't know if you just mentioned, my apologies. I'm at home and so it's always a little bit hectic in the morning. But no, just that we had two versions of it. Was that said? No.
No, go ahead.
Okay, so because we had the two versions of the survey, we had to take a little time in shuffling through them because we did drop a few questions and then we added new ones. We treated all of the participants as if they were new participants. So we didn't double check to see if the same people actually filled out both versions. Just wanted to kind of give that disclaimer because we did take some time to try and sort that out. But that's all I wanted to add. Thank you, Ani.
Yeah, thanks, Ivy. Yeah, as I said, we sent out a survey because we wanted to understand what your thoughts were on the major issues and topics related to the CSW 67 priority theme. We received an overwhelming number of responses, at least we didn't expect that. So thank you everyone who took the time to respond and fill in the survey. You can see we received around 500 responses. The majority identified as female. We did have some male respondents, which is great. There might be a typo there. It's not 321, should be around 30 or something. Other respondents that identify with other genders. What was interesting that we had relatively equal representation across North America, Europe, Latin America, and the Caribbean, as well as Africa, but we could do more and try to engage constituents from Arab states and MENA, as well as, no, I think that's Latin American, Caribbean, and Asia Pacific has more representation. So it's good for us to know, so we can try to find more creative ways maybe to engage with communities in those regions. The same can be said when we look at the chart for our respondents' age. You can see we have less responses from the younger generations, and it's great input for us. Also, for your information, we translated the survey and it went out in French and Spanish as well. But the majority of responses, as anticipated, came in from our English-speaking constituents. That's a quick overview because we want to dive into the more interesting and important part of the survey. So if you go to the next page, the team will take on from there.
So I'll jump in here for the YLYPs. Sorry, I have a sticker on my. Yeah, so we also sent a survey to our YLYPs mailing list. Yeah, so these are just kind of the overall patterns and concerns that we noticed from the YLYP respondents. So there is a concern over the lack of awareness around data. It's security, privacy, who has it, and what they're doing with it. There's also a concern about the lack of access to digital literacy training and education. Cultural and social norms preventing tech access is also another priority and issue. Gender norms and inequality causing underrepresentation of women and girls in STEM is another big issue, and technology threatening women and girls' human rights through cyberbullying, harassment, stuff like that. So the next slide, I think Rahel is presenting this one.
Sure, thanks, Devin. So we also collected some qualitative data to flesh out the demographic and statistical data that we were gathering. We wanted it to capture a more clear and vivid picture of what the lived experiences are of young girls and women across the 5 regions. So we pulled out some key quotes, and here they are. One says, in my view, most of the technology issues facing women and girls in my community center on those individuals whose overall education is lacking because of a myriad of reasons. Another says that they are very concerned with harassment and stalking online. Others say that there's a lack of technology education for incarcerated and formerly incarcerated women, and that makes it hard for them to navigate areas and avenues to inclusion and equity for sustainable careers. Another respondent says that extreme poverty, lack of electricity, and very low education levels are the primary barriers to accessing ICT, internet and communications technology. And we see that repeatedly throughout the survey across all 5 regions. Another respondent echoes, the cost of electricity is an issue, especially in winter. This also links to the intersecting concern of climate change. One thing that we looked at through our survey is how internet communication technologies and the entire industry, how Wi-Fi access, how the cell phones that we use, it have impacts with climate change. One respondent said, climate change, increased energy consumption and waste can lead to other health problems that could lead to more problems in women with reproductive health, pregnancies, and family care. So as you can see, all of these quotes together paint a very broad picture, and they can all be summarized in the context of COVID and the context that we're dealing with right now, where one respondent just said, everyone just accepts the new normal. And that was speaking to the fact that our lives have primarily shifted online. And while that has promoted connectedness and has opened up opportunities for people who are historically left out, it has also created a new barrier. So we can talk more about that later, but this is just an overview of how some of the experiences are expressed and how some of these issues are viewed across regions. And you'll notice that there are more similarities than differences. Over. Thank you, Devin.
Cool, thanks, Rael. So this is kind of an overview of the different sub-themes within our survey. So the survey categorized questions into different themes: affordability, accessibility and equity, privacy and safety, and environment and human rights. So for affordability, generally internet costs seem to be affordable and at least not different based on gender. However, there is a considerable gap in financial resources between the global north and the global south when it comes to investing in preventing digital inequalities for women and girls. Next box.
Rahel, did you want to cover accessibility and equity?
Absolutely, sure. I wanted to flag that when we talk about accessibility, it's also important to think back to the first slide that we showed with the demographic data. It's very significant that the majority of our respondents were actually older women in their 30s and up. So that tells us a lot about who has access to ICT overall in many ways. So some of the key, well, actually the key takeaways for accessibility and equity are that there is a considerable gap in access to data literacy and training between North America and Europe and the rest of the regions. And when you're hearing this, I could imagine what you're thinking. Yeah, great, tell me what's new. There's a gap in equity between the global north and south, between east and west. But why this is significant is because we see in some regions throughout Africa, Asia, Latin America, access to Wi-Fi and access is actually increasing, but there are other barriers that come with that in terms of access. So we can get further into those details later. The other major takeaway theme is that all regions report unequal access to ICT in rural areas, among indigenous populations, among elder women, and among people with disabilities. The last one is very significant. It was reported across all regions that women with disabilities ranging from blindness, women who are deaf, women with learning disabilities, women with different, neurodiversity, do not have the support that they need in order to use internet and communications technology. So this is something that was also flagged and something that we certainly need to address.
Thank you, Rahel. And so for privacy and safety, actually, so we had divided the data among us by regions, and mine was Africa. And I can tell you that Africa region definitely mentioned this a lot over and over. And so there is a lack of awareness on personal data usage that was across all regions. Public access of ICTs, risks, privacy, and security. I think this is going to be more and more of an issue as we multiply the number of devices that actually are on Wi-Fi. And Africa was concerned, again, about the human rights of women and girls threatened by digital technology. So lots mentioned about harassment, about the misuse of social media without their knowledge in not positive ways, of course. But that's my section, so I'll pass it on to Ani.
Thank you, Ivy. Just to mention, by the way, we didn't introduce the slide, but this is takeaways by theme across all regions. So we looked at, we'll send you more detailed slides. We looked at, across all regions and took away the main key takeaways. And when we thought there was disproportional response to one of the issues, we highlighted that. And for instance, as Ivy mentioned, with privacy and security in Africa, something stood out in Asia Pacific connected to social culture norms restricting access to technology. Themes coming up that were prevalent in all of the regions, for instance, discriminatory norms hindering women's representation in STEM, so very much cultural and social norms would hinder women going into that field. Also, the connection between tech and climate change was of concern across all regions, and that affecting women and girls disproportionately. And most respondents across all regions believe that women and girls' human rights are threatened by technology in some shape or form, and some of that filters back to privacy and safety as well, because that's a major concern. And these are all the highlights we have by theme, and I think Ivy will take us into the topics we were able to prioritize and what happens next.
Yes, so of course, thank you very, very much to everyone who filled out the survey. We know that it was quite extensive. Lessons learned on some of that, but we just had a really hard time limiting the number of questions, and we wanted to keep it open-ended on all of them as an option so that you can always write in something that we had missed. And we actually, and like you had seen, Rahel had presented the qualitative data. We have so much rich data there. We need a lot more time and experts to analyze them, I believe. But we came down with these 8. So out of the 8, we'd like your opinion on which 5 are top priorities for you. And I know it's going to take a little time to read through them because it's a lot of words there. And while you're reading through, I'd like to make one more comment about the YLYPs, which I found quite interesting because of those respondents. So the other surveys to the general listserv, the least participated region was MENA and Arab, and YLYPs, that was actually the top. Is that right, Devin, if I remember correctly, the top or the number 2? Anyway,
yeah, if it wasn't the very top, like it was at least a lot more proportionally than the general survey, for sure.
So that seemed very encouraging. I just wanted to share that comment. So we are going to take the poll now. I think you see it on your screen. I see it on mine. So we'll give a couple minutes.
So you should, we want you to choose your top 5 out of these 8. It is a multiple choice question, so you can choose more than one. So just take some time to read through them and choose your top 5 priorities, the ones that you think are the most pressing or the most important. Yeah, thanks. Getting a lot of responses. I'll just wait a couple more moments to let some more people respond. I know there's a lot of words to read and process, so we'll take another minute and then I'll show y'all the responses.
And as people fill in, I just thought I'd mention again, it says it on the slide that these are our preferences. So please feel free to jump around.
Okay, so I will end the poll. It seems we're slowing down a bit. Okay, can everyone see the responses? Yes.
Yes, we can.
Great, thanks. So it's a relatively even for a lot of them. So I think the most is access to and availability of technical digital education and training. Also technology and digital impact on women's and girls' human rights. Accessibility to tech in rural areas among elders and people with disabilities is another top one. And the least chosen is underrepresentation of women and girls in STEM, followed by the large gap between the global north and global south across all topics. Great, thank you so much everyone for participating. I'll stop sharing that. I will just say real quick that we are having interpretation for the next part of our meeting right now. You should all still be able to see these slides. So we're going to have interpretation available in English, French, and Spanish. And to access that, you'll have a little globe picture at the bottom of your screen that you can click on and choose which language you'd like to listen in on. So Ani and Ivy, is there anything else to add, or or is it Hootie's? Is it back to Hootie? Okay, Hootie,
Thank you.
all you.
I do not want to miss this opportunity to thank this incredible team. As I said earlier in my intro, this year we are going to try very hard to bring in more voices before we make recommendations to member states for CSW 67. And today was a perfect example. So on every monthly meeting, you will hear from ARG. Be prepared to really engage with us. These polls are obviously very important because we can show to member states what the population, what feminists around the world are asking for. So it's not just us talking. So I really want to take this opportunity to thank ARG again, Ivy, Rahel, Ani, from your vacation, and of course, the one and only Devin, who supports us all behind the scenes. And now I want to hand over the meeting just a few minutes late to Luisa, who's our new executive committee member, part of FOS Feminista. Her and her team put together an amazing program. You will access, we'll share the program again. Their bios are in there, so I'm just going to save time and hand the floor over to Luisa and thank her for this program in advance. Luisa?
Thank you, Huri. And thank you everyone for an amazing presentation and for the opportunity for FOS Feminista to be organizing this roundtable today. It is a pleasure to be here. Allow me to introduce myself. Good morning, good evening, good afternoon, everyone. Again, my name is Luisa Kislinger, and I'm a senior advocacy officer at FOS Feminista. I am from Venezuela, but I'm currently based in New York, overseeing our advocacy work in UN spaces. I'm not sure if the interpretation is working already. Is it working? Just to get the confirmation.
Yes, it is.
Wonderful. Thank you so much. So a brief introduction. FOS Feminista is an intersectional feminist organization centered around the sexual and reproductive health and rights of women, girls, and gender diverse people. Together with local partners across the globe, we engage in healthcare, education, and advocacy to advance our agenda. This includes providing sexual and reproductive health services and implementing community-based strategies that make sexual and reproductive healthcare more accessible to the most marginalized women and girls. We also engage young people with comprehensive sexuality education and provide care to survivors of gender-based violence. Today, we're pleased to partner with NGO CSW New York to bring you a roundtable on CSE and digitalization, and to talk about the possibilities of CSE delivery using digital technologies. We do this in the spirit of opening up the conversation and collective reflection around CSW 67, next year CSW, priority theme, innovation and technological change and education in the digital age for achieving gender equality and empowerment of all women and girls. The right to comprehensive sexual education is recognized by numerous international policy agreements, including the Beijing Platform for Action and the 2030 Agenda for Sustainable Development. Still, young people in many countries are unable to access CSE programs as a result of political opposition, delayed and uneven implementations, and service delivery gaps in education. Lack of access to CSE and sexual and reproductive health and rights, information and services expose adolescents and young people, especially girls, to increased risks to adolescent pregnancy, sexually transmitted diseases, and sexual and gender-based violence. These issues, which have become more prevalent amid the COVID-19 pandemic, highlight the need to increase efforts around access to CSE. One clear and important direction the education sector is taking in light of the experience of the pandemic is that of harnessing digital technologies and spaces to ensure service delivery and access while addressing issues such as the digital divide and gaps in access to technology. Those working at the intersections of gender and education, including CSE, have the opportunity to advocate and influence this agenda next year at the Commission on the Status of Women, and sooner at the Transforming Education Summit, which is opening tomorrow. So we have a great panel for you today, comprised of representatives from 3 organizations doing very progressive work on CSE and digital technologies. First, we'll hear from Paola Peñaranda from the Centro de Investigación, Educación y Servicios, CIES, in Bolivia. Then we'll hear a presentation from Faithful Fabigi from the organization Education as a Vaccine, EVA, in Nigeria. And then we'll close with the roundtable. We close the roundtable with the presentation of Ramya Anand from the organization talking about reproductive and sexual health issues, TARSHI, in India. De esta manera, para comenzar, me gustaría entonces presentar a Paola Peñaranda de CIES. Paola está al frente del programa de educación para adolescentes y jóvenes de CIES en Bolivia y tiene un título de psicología y un máster en gerencia estratégica, además de distintos títulos en educación sexual integral y educación. Adelante, Paola, tienes la palabra.
Hola, buen día, buenas tardes en otros lugares. Gracias por la presentación. Yo voy a compartir la pantalla o ustedes van a mostrar la presentación. Estoy inhabilitada para poder compartir.
You should be able to share your screen.
Paola, ya puedes, ya pudieras, ajá, ya puedes.
Bueno, muchas gracias por la invitación para poder compartir lo que sí es desde Bolivia, trabaja en educación integral en sexualidad. Mi presentación va dirigida sobre todo a fundamentar la importancia de la educación integral en sexualidad para la despatriarcalización, para la prevención de embarazo y para la prevención de violencia. ¿Se ve bien la presentación?
Se ve si la puedes poner en modo,
Yes.
tienes que ir al principio arriba donde dice presentación con dispositivos para que se muestre en toda la pantalla, para que no veamos arriba en la pestaña que dice presentación con dispositivos, al lado de grabar, arriba.
En el PowerPoint, pero estoy aquí.
No, más arriba, donde dice animaciones, al lado, ahí, al lado, ahí. Y le das desde el principio, a la izquierda, ahí, exacto. Ahí debería mostrar la pantalla completa. ¿No?
Sí, no me deja. Sí, le pueden subirla.
Si no, te puedo
Voy a dejar de
ayudar.
compartir y nuevamente te ayudo, Vila. Que te la ponga ahí así. Ahora sí, ¿no?
Sí.
Bueno. ¿Sí? ¿La tenemos?
Sí, adelante.
Bueno, como les decía, voy a compartir con ustedes lo que desde Bolivia y desde CIES trabajamos en lo que es educación integral en sexualidad y presentarles un trabajo que hemos realizado para argumentar la importancia de la educación integral en sexualidad. Bueno, CIES es una organización boliviana que trabaja por los derechos sexuales y derechos reproductivos. Hace 34 años en Bolivia, ¿no? Trabajamos especialmente con población vulnerable. Y bueno, durante estos 34 años hemos adquirido una experiencia muy importante.
English.
Es educación integral en sexualidad. Entonces tenemos una currícula que trabaja de manera integral de educación sexual, con un cumplimiento de un 99% de estándares, que evalúa feminista a partir de una herramienta que se llama Fondo, que considera indicadores y características específicas que la UNESCO ha establecido para los procesos de educación integral en sexualidad. Tenemos una metodología activo-participativa reflexiva para desarrollar competencias en este ámbito, herramientas didácticas de alta calidad que elaboramos conjuntamente el equipo técnico de la institución, jóvenes, maestros, familias y aliados estratégicos. Yo quiero mencionar a MEIS porque últimamente hemos recibido el apoyo para poder adaptar y contextualizar videos con muy buena calidad en contenido, ¿no? Trabajamos en el empoderamiento de niños, niñas, adolescentes y jóvenes en derechos sexuales y derechos reproductivos a través de estos procesos de educación integral en sexualidad. Esto ha permitido que conformemos una red a nivel nacional de jóvenes reconocida en diferentes ámbitos, que tiene más de 400 jóvenes integrantes anualmente, que llegan a más de 8,000 adolescentes y jóvenes con informativas para. Este trabajo ha sido reconocido por el Ministerio de Educación y es así que CIES es un aliado estratégico de esta instancia estatal para trabajar procesos de educación integral en sexualidad. Hemos formado maestros y maestras para la implementación de procesos de educación integral en sexualidad y conformado una red a nivel nacional. Son 29 años que trabajamos con maestros y maestras en su formación para trabajar procesos de educación integral en sexualidad. Esta red es la única red aquí en Bolivia que es especialista en salud sexual, salud reproductiva, en procesos de educación integral en sexualidad. Está conformada por más de 350 maestros y maestras de diferentes niveles. Ha sido reconocido por el Ministerio de Educación como aliado estratégico, ya que llegan a más de 7,000 adolescentes y jóvenes a nivel nacional con procesos de educación integral en sexualidad. Pero ¿por qué resalto a esta red? ¿No? Resalto esta red nacional de maestros y maestras porque como institución nos ha fortalecido desde su experiencia en campo, sus comentarios, sus sugerencias para contar con toda esta experiencia y contar con procesos de educación integral en sexualidad que realmente desarrollan competencias, ¿no? Conocimientos, actitudes y habilidades, y nos ha permitido posicionarnos también ante el Ministerio de Educación. Esta experiencia que ha fortalecido nuestros procesos, nuestras metodologías, nuestros materiales, ha permitido también elaborar un documento que nos va a servir a nosotros en el país para argumentar la importancia de la educación integral en sexualidad. En Bolivia, este año se ha declarado el año de la despatriarcalización por una vida libre de violencia contra las mujeres. Y hay el mandato de trabajar desde los diferentes sectores la deconstrucción de género, trabajar descolonización y despatriarcalización en los diferentes programas de estudio, reflexionar acerca de los aspectos patriarcales. Entonces, muchas veces desde un sistema, desde el sistema educativo que tenemos, no se sabe cómo trabajar estos contenidos. Está en la currícula, hay varios temas que forman parte de educación integral en sexualidad, que se encuentran en la currícula, pero no saben cómo trabajar, por qué trabajar, ¿no? No existe una idea clara del trabajo que se tiene que realizar. Entonces, como en el sector de educación se tiene que trabajar estrategias para reflexionar acerca de estos temas, la red de maestros y maestras asume a la educación integral en sexualidad para dar respuesta a este mandato que se tiene desde el gobierno, ¿no? Y desde los diferentes ministerios. Pero cuando hablamos de educación integral en sexualidad, al menos en mi país todavía existen dentro del sistema educativo, dentro de la comunidad educativa, llámese estudiantes, maestros, maestras, sector administrativo, familia, muchos mitos, ¿no? Existen todavía muchos mitos, no hay un entendimiento real de lo que es la educación integral en sexualidad. Esta integralidad todavía no se ha captado y tampoco está plasmado en la currícula, pese a que existen estos contenidos, ¿no? Y el mandato de trabajarlos en aula. Aún estamos con esa mirada biologicista. Por lo tanto, cuando se habla de educación integral en sexualidad, tenemos a padres y madres que se asustan, familias que se asustan de trabajar estos procesos, maestros y maestras que se oponen. Entonces empiezan a generarse diferentes barreras, porque piensan que desde esta mirada biologicista, la educación integral en sexualidad va a ser hablar de tener hijos, de volverlos a sus hijos gays, de hablar de las diversidades sexuales, de hablar de los órganos sexuales e incitarlos a tener relaciones sexuales, ¿no? Que seguramente son también mitos que en muchos de sus países aún se manejan. Entonces se ve la necesidad de poder mostrar que la educación integral en sexualidad no es solo hablar de estos temas, ¿no? Y es así que se trabaja en el último encuentro nacional que tuvimos justo hace unas 2 o 3 semanas con la red de maestros y maestras, con delegados de todo el país, con la presencia del Ministerio de Educación también, argumentos que van a dar a entender la importancia de trabajar diferentes temas que nosotros, instituciones, desarrollamos en estos procesos de educación integral en sexualidad para la prevención del embarazo, para la prevención de violencia y para el trabajo en despatriarcalización. Lo que yo les voy a presentar a continuación son las reflexiones en 4 temas, un resumen de 4 temas, pero sabemos que en estos procesos de educación integral en sexualidad hay muchos más temas, ¿no? que se desarrollan. Hemos hecho también un análisis de cada uno de estos temas y se van a dar cuenta que parecen reflexiones básicas, que parecen análisis obvios, pero el momento en que nosotros nos hemos sentado a analizar de esta manera por qué un tema previene el embarazo, por qué otro tema previene la violencia, por qué otro permite trabajar la despatriarcalización, realmente ha sido difícil después de 29 años de experiencia aterrizar en este porqué, ¿no? En este fundamento, en este argumento, ¿no? Entonces se venía a la cabeza técnicas, conocimientos, metodologías, pero ¿para qué? ¿Cómo este tema trabaja estos aspectos, ¿no? Y yo les invito a todas y todos ustedes a que puedan hacer esta reflexión con los grupos con los que trabajan para caer en cuenta realmente de la importancia de lo que es la educación integral en sexualidad, más allá de una metodología, más allá de conocimientos, más allá de la experiencia que se tenga, porque para nosotros no ha sido tan fácil, ¿no? Pero bueno, voy a compartir con ustedes este análisis de 4 temas. Tenemos autoestima, que es un tema que siempre nos piden, que generalmente lo desarrollamos cuando hablamos de educación integral en sexualidad. Y a ustedes les pregunto, ¿por qué la autoestima permite la prevención de embarazo? ¿Por qué? ¿Sí? ¿Qué hace? ¿Qué hacemos cuando trabajamos? ¿Qué pasa cuando nosotros trabajamos autoestima? Para la prevención de embarazo, ¿qué generamos? Generamos que los niños, niñas, adolescentes y jóvenes sean resilientes a la presión de su pareja, sean resilientes a la presión de grupo, sean capaces de establecer lo que quieren y no quieren. Entonces el discurso ya no es porque primero tenemos que conocernos, primero tenemos que amarnos, ¿no? Como personas, que es real. Sin embargo, a nivel técnico tenemos que justificar o argumentar que la autoestima genera esto para la prevención de embarazo. ¿Por qué la autoestima permite la prevención de violencia? Bueno, yo les voy a dar como 2, 3 reflexiones que hemos generado y estoy segura que cuando ustedes hagan el análisis salen muchas cosas más, pero yo por temas de tiempo se los voy a dar 2 o 3 análisis que hemos hecho. ¿Por qué la autoestima previene la violencia? Porque permite entender el buen trato, ¿no? Por lo tanto, permite reconocer lo que me hace sentir bien y lo que me hace sentir mal. Me permite reconocer situaciones de riesgo, porque si yo soy capaz de establecer lo que me hace bien y lo que me hace mal, soy capaz también de poder reconocer situaciones de riesgo. ¿Por qué la autoestima permite trabajar la despatriarcalización? Porque permite reconocerse a uno mismo o a una misma como un ser autónomo, que es lo primero que nosotros tratamos de trabajar en procesos de educación integral en sexualidad, para asimilarse como una persona de derechos. Se reconoce como una persona con derechos y permite la reflexión sobre los roles impuestos. Si yo me reconozco o me conozco como mujer, como hombre, no sé, con el género que yo me reconozca, voy a hacer una reflexión de los roles que me están imponiendo actualmente. Vamos a ver el siguiente tema. Aún se puede reflexionar mucho más sobre estos temas, pero ya no es un concepto de autoestima, ¿no? El que nosotros presentamos. Género. Género. ¿Por qué género permite la prevención de embarazo? Porque permite reconocer la autonomía de decidir como mujeres sobre nuestros cuerpos. Porque permite generar un análisis del rol de la mujer madre, de la mujer cuidadora, ¿no? Que muchas veces, al asumirlo, nos lleva a tomar decisiones acerca de un embarazo no deseado, por ejemplo. ¿Por qué género permite la prevención de violencia? Porque hacemos un análisis de la apropiación del cuerpo de las mujeres en este sistema patriarcal. Porque permite desmitificar ese amor romántico que todos sabemos lleva a conductas de riesgo. Porque genera sororidad entre las mujeres. Porque desnaturaliza la violencia. ¿Por qué género lleva a la despatriarcalización? Porque permite el entendimiento de la influencia del sistema patriarcal en nuestras vidas. El entendimiento de las opresiones que vivimos, las diferentes opresiones que vivimos, no solamente de género, ¿no? El reconocimiento de la posibilidad de transgredir estos roles impuestos por este sistema. Entonces, si ustedes se dan cuenta, y eso hablábamos con la red de maestros y maestras, cuando yo digo voy a hablar de género en educación integral en sexualidad, los padres, las madres, la familia, hasta los mismos maestros se asustan, incluso mismos técnicos de los ministerios, ¿no? Se asustan, ¿no? Que van a traer aquí la ideología de género. Pero si yo argumento de esta manera, voy a tener mejor recepción hacia el trabajo en procesos de educación integral en sexualidad. El tema de toma de decisiones, y están viendo, aquí no estamos hablando de sexualidad, que son los temas que generalmente piensan que vamos a trabajar, ¿no? Sexualidad, acceso a anticonceptivos, el aborto. No estamos hablando de estos temas que les asusta a la comunidad en general. Estamos hablando de toma de decisiones. ¿Por qué la toma de decisiones permite la prevención de embarazo? Porque nos permite entender que tenemos autonomía para decidir sobre nuestra vida, sobre nuestro cuerpo, sobre tener o no tener hijos, sobre interrumpir o no el embarazo, por ejemplo. ¿Por qué la toma de decisiones nos lleva a la prevención de violencia? Para entender que, la toma de decisiones permite entender que a la violencia como una situación de ejercicio de poder que quiere controlar nuestro cuerpo, nuestras decisiones y nuestra autonomía. Nos permite decidir denunciar, porque sabemos que cuando trabajamos toma de decisiones, trabajamos cómo se toma una decisión. Nos permite establecer acciones de prevención, porque también las acciones de prevención es decidir sobre algo. Nos permite reconocer las situaciones de riesgo, porque cuando uno toma decisiones, pues tiene que recabar información, y en este proceso de recabar información, yo puedo reconocer esta situación de riesgo. ¿Por qué la toma de decisiones permite trabajar la despatriarcalización? Porque voy a entender si quiero o no quiero formar pareja o no, porque voy a poder tomar decisión de esto, si quiero formar una pareja o no, si quiero formar una familia, qué tipo de familia quiero conformar. Ustedes saben que todo este tema de la pareja, todo este tema de la familia nuclear es una herramienta del patriarcado para perpetuar los roles de género establecidos, ¿no? Y por último, uno de los temas que también entiendo trabajamos, casi todas las instituciones cuando hablamos de educación integral en sexualidad, los derechos sexuales y derechos reproductivos. ¿Por qué los derechos sexuales y derechos reproductivos para la prevención de embarazo? Porque nos permite reconocernos como personas sujetas de derecho. Porque entendemos que es un derecho acceder a servicios integrales de salud. Porque tenemos la capacidad de demandar la garantía de estos derechos. ¿Por qué para la prevención de violencia? Porque nos permite reconocer que tenemos derecho a acceder a servicios integrales de prevención y atención de violencia, exigir la garantía del Estado para tener una vida libre de violencia. ¿Y por qué los derechos sexuales y derechos reproductivos para la despatriarcalización? Porque permite que nos reconozcamos los derechos a la no discriminación por identidad sexual, por género, por raza, posición económica, por ejemplo. Entonces, cuando hablamos con la red de maestros y maestras, decimos, claro, cuando ya salga el Ministerio de Educación y exija que en las unidades educativas o en todo el sistema educativo se trabaje educación integral en sexualidad, si damos estos argumentos, va a ser mucho más factible que reduzca las resistencias que existan en la comunidad educativa en general para trabajar estos procesos de educación integral en sexualidad, que es una de las barreras más grandes con las que tienen que lidiar las personas que trabajan estos procesos o que quieren trabajar estos procesos dentro del sistema educativo. Nuevamente les invito a hacer esta reflexión y a generar este tipo de argumentos para entender la integralidad de la educación sexual, ¿no? Y para mostrar que ya no estamos con esa mirada solo biologicista de la educación integral en sexualidad y para lograr que se entienda que la educación integral en sexualidad es parte de la vida, ¿no? Y es así como entendemos en este momento la red de maestros y maestras y CIES, que es necesario abordar la educación integral en sexualidad para disminuir cualquier resistencia que se tenga al respecto. Muchas gracias.
¿Tienen preguntas?
No sé si van a pasar a las preguntas, estoy atenta.
Muchas gracias, Paola, por esta presentación que además nos sirve para ponernos en contexto del tema que estamos discutiendo, relacionado además con el tema de acceso a educación y el uso de las tecnologías. Creo que es muy importante los puntos que has presentado sobre cómo se trata de una educación que se aparta de esa mirada tan restringida, es una mirada, es una educación integradora, es una educación transformadora, y bueno, es muy útil que nos hayas hecho esta presentación para entonces también escuchar otras experiencias de otras latitudes, como vamos a empezar a escuchar. Veo que hay una mano levantada, pero estamos un poco cortas de tiempo. Le voy a dar la palabra a Charlotte para que pueda hacer sus comentarios, pero luego vamos a continuar entonces con las presentaciones, si es posible. Charlotte, por favor, adelante.
Oh, thank you. Oh, there's an exceptional presentation. Often when we talk about, oh, is this a successful program or teaching platform? Like I rarely hear, oh, what do the students say? You know, so what's the students' feedback on your platform? And the other thing was really excellent on, okay, as the United Nations, we have a benchmark organization, 400 students. What is your success rate, right? Did the students learn? What kind of take back did you have? And I really appreciated addressing the myths of, you know, what's the barriers to education. And I was wondering about like, you know, what is our intention with this education? And it's like, for me, you know, none of these people are saber-toothed tigers, right? So the situation is we just want to teach, I'm taking this person for who they are, right? And to know that, oh, we're building a society where however I identify, people will accept me for who I am. And so we're working with frontal lobes, I like to say. So what is your feedback on, you know, and once we get that, this is a valid program, what's the metrics? That's how we get, you know, talking to ministries and engaging in other organizations and spreading the news, is really having that, was this effective? And so how do you know your platform's been effective and getting that feedback from the students, really? Do you have a platform where you hear the students' feedback, out of curiosity?
Por favor, Paola, adelante. Paola, ¿nos escuchas? Paola.
Hola, hola, sí. Bueno, en realidad el trabajar en este documento nos genera la necesidad de primero lograr dentro del sistema educativo la comprensión de estos contenidos, ¿no? Del trabajo de estos contenidos, de lo que son los procesos de educación integral en sexualidad. El trabajo con los adolescentes y jóvenes en todos los procesos virtuales que nosotros hemos realizado ha sido en este sentido, de hacer estas reflexiones respecto a las diferentes temáticas, ¿no? Dar a entender primero, porque nuestro primer trabajo ha sido maestros y maestras, porque son los que implementan estos procesos de educación integral en sexualidad, que entiendan la importancia de cada uno de estos temas, que muchas veces se desarrolla en cuestión de conocimientos simplemente, ¿no? En cuestión de conceptos, que entiendan por qué cada uno de estos temas son importantes. Hay temas, por ejemplo, como el plan de vida que generalmente nos piden en las unidades educativas. Un plan de vida, pero que nos piden para la prevención de embarazo. Perfecto, pero se necesita un plan de vida para adolescentes y jóvenes que viven en una familia donde la violentan, donde la violan. Entonces, ¿qué hace? Tiene que establecer un plan de vida para determinar qué hace en este ámbito. Un plan de vida para aquellas adolescentes de bajos recursos económicos, ¿no? ¿Qué va a hacer esta mujer? ¿Qué plan de vida? Orientar en ese sentido para que no sean objetos de trata y tráfico, para que no sean objetos de estupro, por ejemplo, ¿no? Entonces, ir más allá, o sea, reflexionar realmente sobre lo que quiero trabajar en cada uno de los temas. Yo quiero que sepan que es plan de vida, perfecto, ¿no? Mis contenidos, mis metodologías, mi didáctica irá relacionado a este objetivo. Pero si yo quiero hablar de plan de vida para evitar que estas adolescentes que viven pobreza, que viven violencia, no sean objetos de trata y tráfico, creo que va cambiando, ¿no? La mirada del trabajo que se tiene en educación integral, en sexualidad. Muchas veces nos hemos quedado en conocimientos, muchas veces nos hemos quedado en conceptos que hasta los adolescentes y jóvenes ya conocen de memoria, ¿no? Porque lo trabajan en sus unidades educativas, lo trabajan con sus grupos de jóvenes, en la iglesia, no sé, diferentes ámbitos. Entonces creo que hay que reflexionar un poco más sobre lo que yo realmente quiero con cada uno de los temas que trabajo en educación integral en sexualidad.
Muchas gracias, Paola. Muchas gracias. Gracias por esas reflexiones. Entonces, I'm going to turn into the next speaker for today's session. So I have the pleasure to introduce Faithful Fabigi from the organization Education as a Vaccine, EVA, which is based in Nigeria. Faithful is a program officer at Education as a Vaccine. She's one of the counselors on the My Question Surveys platform that provides accurate, non-judgmental sexual reproductive health information to adolescents and young people. And she has contributed to policy and guideline development, program design, and implementation for adolescent girls and young women in Nigeria. Faithful, you have the floor. Please go ahead.
Good afternoon, everyone. So I'm so happy to be here. Today, I'm just going to be giving a very, explanation of what we've done at Education as a Vaccine using the My Question and Answer platform. So can I go ahead and share my screen, please?
You should be able to.
Okay. Okay, so Education as a Vaccine is an organization in Nigeria that focuses on ensuring that young people, especially adolescent girls and young women, reach their full potentials. And one of the thematic areas that we look into is ensuring the delivery of comprehensive sexuality education, especially for adolescent girls and young women and young people in general. So just for so we can understand the context in which we're coming from. Comprehensive sexuality education enables young people to, understand, protect, and advocate for their health, well-being, and dignity by providing them the necessary tools so that they can be able to have information, knowledge, attitude, and skills. What I'm trying to explain here is that, comprehensive sexuality education is really broad, but when you understand the aim of something, for us, the aim is to ensure that individuals are able to stand on their own to protect themselves with support from the community and society in which we live in. And so one of the key requirements for them to be able to do this, to make informed decisions, is for them to be knowledgeable, to have accurate information. And in Nigeria, which I also believe based on the conversation we just had, there are some of the factors that hinder comprehensive sexuality education delivery for adolescents and young people. Some of these are societal and cultural norms. Cultural norms play a very major role in attitudes, in the kind of conversations you can even have with people, especially because culture is one thing that Nigeria is very big on. We have different ethnic groups, and so there are some perceptions, there are some perspectives that people come from, and that in one way or the other affects the way young people view sexuality and sexuality education. Another major issue we have is some of the environments that are rural or slum or semi-slum, urban slum areas are very hard to reach. Some of them you'd have to cross through water, and some of them are really, really far. And so because of that, it can be very difficult to deliver a comprehensive sexuality education when you're thinking about you going physically to those areas. Another major issue, especially for young people, is lack of confidentiality. Young people like myself, especially for girls and young women, we are very big on privacy. And because of that, we prefer to keep quiet than to have conversations with somebody we do not trust. And keeping quiet means that you're not even asking questions, and you have things that are bothering you, that, and lack of information would not make you take decisions that you wouldn't have taken if you were aware of the meaning or the things to do or what it actually means. For example, just thinking about some of the interactions I've had as a counselor under my question and answer service, I'd gotten a question from somebody saying that she thinks she's dying. And I was really confused. And the reason why she thought she was dying was because she was bleeding. And she didn't understand that it meant menstruation. And she was asking me what drugs she could take to stop bleeding. And she didn't know how to tell her mom she's bleeding. So it's very, young people would literally keep quiet if they're not sure of the way they'll be responded to. Another issue we have is judgmental responses. Because of the ideas that are in people's minds, it could affect the way they deliver information and responses to people. And then young people are very, very conscious of not being judged. They do not want to be in situations anywhere where they would be judged. Then in Nigeria, there are lots of myths, misconceptions, and misinformations that have been inherited, that have gone in from one generation to another. And you'd literally be wondering, like, what is the logical sense behind this information? Because they are just myths, they're not facts, they haven't been proven, but it's generally known. And this hinders comprehensive sexuality education delivery for us. Then there's perception among parents and some community leaders that sexuality education encourages promiscuity. So they would say, oh, it's better the child is not even aware of their body, that once they get aware of their body and they reach a teenage age, they'll begin to be promiscuous. And there are a lot of practices, traditional harmful practices that are being practiced in various countries that would, in quotes, want to prevent promiscuity. This also are misconceptions and misinformations that hinder comprehensive sexuality education. So education as a vaccine, after seeing some of them, all these factors that hinder comprehensive sexuality education, now came up with a method, a platform that would help us, overcome these challenges and be able to successfully deliver on comprehensive sexuality education. And we use digital technology. Now, looking at the benefits of digital technology, we know that it would help to increase the reach of interventions, because we literally cannot be everywhere at the same time, but technology is already everywhere. So that's leveraging on an existing platform, and it ensures sustainability, because after a program, you'd leave and phase out of the community, but technology remains with them, and then you can continue to use that to interact with them. And then it breaks the barriers that are caused by social norms, because everybody or most people have phones, and you don't need permission to be able to, talk to somebody on the phone. It's between the recipient and the receiver. Then there's anonymity and easy access. It's easy for you to pick up your phone now today and go and check for what you need on the internet. Then one other benefit that we saw was that it's very easy to ensure confidentiality and non-judgmental services is delivered to adolescents and young people, especially adolescent girls and young women. And then we have tailored information, because sometimes you could be in a room and you just be talking, but when it has to do with digital technology, you can tailor the information to the recipient that is receiving the information, and then there's increase in the fidelity of interventions, because most of our interventions were now more specific to the people. So what is my question and answer service platform all about? I know that from the beginning of this presentation, you're asking yourself, okay, we know this. Yeah, we understand the benefits. So what did you do? Over the last 15 years, we've continuously engaged adolescent girls and young women through digital technology to provide accurate, comprehensive sexuality education. If you're there listening to me before, you'd realize I was talking about myths and misconceptions. And so we've gotten a lot of questions asking, oh, what is this? What is this? What is that? And then we're able to break myths and debunk myths and misconceptions and give accurate information. The platform is, it's a platform where there are counselors at one end, and then there are adolescents and young people at one end, where they send in their questions and they get answered by trained counselors. And we're not asking for your name, we're not asking for, it's anonymous and it's confidential. And we've gotten numerous questions. And because adolescents know that, okay, this is an anonymous platform where these people do not even have access to calling my phone number or anything, they throw in all the questions they want to ask, and then they get accurate answers. We've gotten positive responses from adolescents and young people about their experience from the platform. Then what is the platform all about? So my question service platform is in 4 groups. We have the SMS, which is like you just send your message via a message, like you send your question as a message. You can even use like the very small phones that it doesn't need internet to send in your questions, and then you get answers within 24 hours. There's also the toll-free where you can call a counselor, and then that is totally free. You would not be, the adolescents will not be charged for the service. Then we also now have our mobile applications, because when Android phones became popular, it became very important for us to have a platform where we would actually have accurate information, because there are a lot of resources on the internet and some of them might not be totally correct. And so we developed the Frisky app, which is a sexual health information and risk assessment app. The app was actually designed for adolescents who were out of school, because the information on the app is very comprehensive. And the main idea is for young people to be able to go in there and find out different things about their body, about pregnancy, about puberty, about anything. And wherever they find that maybe the information on the app doesn't answer their questions totally, they can get linked to a counselor to further explain. Then we're also present on WhatsApp, Instagram, Twitter, and Facebook. We're literally everywhere young people are, providing answers to any question that comes from their minds. And we're providing non-judgmental responses. Some of the questions we've gotten so far is, oh, I'm 21. What are the drugs that can be used to flush out sperm? What will somebody, actually during COVID-19, if someone has sex with a COVID-19 carrier, would the person be affected even if they use condom? Because a lot of young people were thinking that COVID-19 was sexually transmitted. And if someone had sex with a COVID-19 carrier, these questions kept on coming about, and then we had to explain why COVID-19 is not sexually transmittable, but can be transmitted through body contact. However, with these old things, there are still some gaps that are in digital technology for us. For the past 15 years, we've responded to more than a million questions, about 1,132,000 questions so far. However, some of the issues that we still have is that there are lots of young people still cut out from the benefits of digital technology because some young people do not even have access to phones. And most of the people who are actually left behind are girls, especially girls and young women living with disability, girls who are in rural areas, and girls who aren't literate, and girls who are financially weak. For most girls, when they call in, they would say, oh, please, I'm borrowing my mommy's phone. Please don't call me back. Or please delete, can I delete the question after I've sent it because the phone doesn't belong to me. So there's poor access to digital devices. Most girls don't have their own phones. And because these conversations we are having are mostly in English. For girls who do not know how to read or write, they're stuck with just phone conversations, and some of them could not even speak English. And so we've taken the initiative to, when they call in, we have a counselor who speaks. We have counselors who speak the 3 major languages in Nigeria, so as to break language barrier, but there are still, some gaps in digital technology. Thank you.
Muchas gracias, Faithful, por esta presentación tan inspiradora y tan interesante, y esta experiencia que definitivamente nos conecta en el tema que queremos resaltar hoy, y es cómo se puede utilizar las tecnologías digitales para llevar la información y la educación sexual integral a todas las personas, a todos los jóvenes, pero particularmente, y es muy interesante ver en tu presentación cómo hacen un esfuerzo muy intencionado sobre cómo llevar la educación sexual integral a niñas, adolescentes y otras personas en contextos remotos, y para superar las barreras del lenguaje y para superar otro tipo de barreras y llegar a estas poblaciones que están al margen, ¿verdad? Ha sido un ejemplo muy ilustrativo de lo que queremos abordar con la mesa redonda el día de hoy. Así que gracias por tu presentación y por esta experiencia. Si les pedimos que por favor, si tienen preguntas, que las puedan colocar en el chat, para que entonces al final de la próxima presentación podamos abordarlas, para que le podamos dar el beneficio del tiempo a nuestra próxima presentación. Y con esto me da muchísimo gusto presentar entonces a Ramya Anand, de la organización Talking About Reproductive and Sexual Health Issues, TARSHI, de India. Ramya is a senior program officer at TARSHI. Her role involves leading TARSHI's capacity building efforts on sexuality, SRHR, burnout prevention, and self-care, including on-site and online initiatives. She has an experience of over 12 years of working on issues related to gender, sexuality, reproductive health and rights, mental health, and advocacy. So welcome, Ramya, and the floor is yours.
Thank you so much, Louisa. And thanks so much, Pahula and Faithful, for getting a context about all the restrictions that are so prevalent across all countries. That must be true across many countries, including that of India. So I will be making a presentation here and sharing the slide. I hope you're all able to see it. It is going to be in English. So briefly, I want to talk about our organization, which is Tarshi. Tarshi is talking about reproductive and sexual health issues, which is a organization based in New Delhi in India. So we started in 1996 with an info line wherein people could call us and ask about any of the queries related to sexuality. So this was way back in 1996, and sexuality being such a taboo topic, it continues to remain so. But also one of the approach that we had was not to just talk in the lens of prevention of abuse or prevention of sexually transmittable disease and so on. We had the approach of pleasure affirming, which also was challenging, but that has been a focus that we've always believed in. So our focus is on gender and sexuality, and we conduct a lot of trainings and so on. And we have also started to work on stress management and burnout prevention, bringing in a lot of intersections, and also CSA, what we call as safe, inclusive, and self-affirming spaces. So giving you the context about specifically about digital media, because in today's presentation, I'm only going to talk about the work that Tarshi has done in the digital media. We all know that digital space is a growing space, especially post-pandemic. It has grown far more than one could have perceived. In spite of that, there is plethora of information available. There's a lot of content that is being created on sexuality. But in a country like India, where we do not have a nationally mandated curriculum for sexuality, it does become very difficult for service providers, for teachers and educators to kind of access or kind of understand which would be the reliable source. And also, the digital space is also not free from the bias or the discomfort that the real world has. So navigating through these various hesitance and all becomes difficult. What Tarshi brings in here is we run e-learning courses, which are some courses in the platform, which is mainly focused on capacity building. I'll come to this later in the next slide. The other way that we are able to engage in sexuality education is through information dissemination and perspective building, which is done through social media platforms. We also have an e-magazine, which is called In Plain Speak, which is a bi-monthly magazine which publishes articles based on a certain theme each month. Also, there is a community learning space wherein which is accessed by all the learners of the e-courses. Specifically, the space is for sharing our experiences, understanding each other's barriers, and trying to find a solution while working on sexuality education. I will specifically talk about Tarshi's e-courses here. So the first course was launched in 2011, which is called Basics and Beyond. So this was based on a training manual that we had published, and the course is one of the first digital space wherein a training on SRHR was made possible. And after that, in 2016, the whole course was broken into two parts, wherein Beyond Basics specifically focused on the sexual and the reproductive rights. In the same year, we launched a comprehensive sexuality education course, which is specifically for teachers and educators. It is in a way capacity building for people in the school setting, and all these three courses are long and extensive courses. In the sense, there is a lot of interaction that happens simultaneously. There is a group the community group also that is there. So discussions happen, and the exercises are also made in a very reflective manner where the learners are able to reflect upon, first of all, their own values, their own beliefs, and address their own misconceptions. And then knowledge building, of course, is a huge part apart from perspective building. We also have a lot of case studies in the e-course, which is very specific to the work, to the context that they work in. The 3 courses are about 18 to 24 hours of study hours. And the learners so far have been from development agencies working with young people or children, also teachers, educators, medical officers, content creators, and so on. The other 2 relevantly new courses, which are the short course and automated courses. One is on sexual harassment at workplace, and the other being what we call as Reflect, Realign, and Renew, which is for stress management and burnout prevention. In Tarshi, we also see to it that we are able to see sexuality with all intersections, and mental health also being one of the intersections. I would like to share some of the feedback that we have had from the CSE, that is the Comprehensive Sexuality course. This is just a snippet of lots of feedback that we have had, but more or less to give an idea, a lot of learners have found the course very informative, and most importantly, it gives them a confidence to talk about these issues with their audience, whether it is children, young people, or parents to their children, and so on. It also challenges their own belief system and clarifies the misconceptions, and also gives them and equips them with a certain language wherein they are able to talk about it. So being a rights-based information, it also centers on the sexuality education being the right of every person, and does not just see it from the prevention of abuse or prevention of infection and so on. So here are some of them. I'll just read it. This is an extremely informative course that would surely enable to talk about sex more freely and comfortably with children and teens around you, someone said. Another learner says, a must-do course for all of us, cleared my fundas about what sexuality education entails and the immediate need of it for the future generation. So, but then, yes, we always have challenges. As I said, digital space is only an extension of a real world. So we also come with its own judgments and so on. Censorship and regulations are there in most countries, and it's the broader environment which is not so conducive for us to freely or openly talk about sexuality education. So we need to kind of be very careful and be within the setting of the regulations that each country has, and similar for India. And we are very careful about it while we are creating the content. And digital divide, as Faithful was also talking about. So this is there is uneven accessibility issues across strata, whether it is to do with gender, the languages, disabilities, or socio-economic factors, educational qualification, and so on. In fact, a study in India says only 20% of women have access to digital devices. And in India, where we have more than 22 official regional languages, the digital space primarily is English, and therefore there is a lot of work that needs to be done to be able to create content in other regional languages, not just content, but also the context setting for each region is also something that we need to look at. Hostility, this is prevalent across all countries, and so sexuality, as it all being a sensitive topic, when it is combined with a hostile environment in the internet, with the trolling and the online harassment, it does become very difficult for people to openly talk about it. Reachability is whether we are able to reach people to whom it needs to be reached. Are we talking in the same echo chambers? How do we reach? I mean, how do we promote our programs in order to reach, in order to have a wider audience? And these are a few questions that we will have to navigate. And sometimes digital space does make it difficult to determine the impact. Wherein it comes to courses, we are able to get a feedback, but where it is a social media or somewhere where there's a lot of information dissemination that happens, if there isn't enough engagement that is happening, it is very difficult for us to assess whether the users are having an impact with the content that is out there in the digital space. Automation, there is always a question of whether it will be possible to automate content which is related to sexuality. In the sense, it is such a unique issue and it affects each of us very differently. And therefore, having just a one-way platform wherein information is being disseminated might not always necessarily work, because there would be questions that one has to address, and whether automated kind of approach would help, because whether it will always require a human intervention to respond to these queries, or maybe the technology will become so sophisticated at some point that the AI will be able to kind of evaluate and so on. But this is something that needs to be talked about also while we are building digital content. What has worked for us is, in spite of all the challenges, is that we have in the digital media, we specific on the capacity building part. And these are for the service providers or students who are from sociology or psychology backgrounds who want to work with children or young people. So the approach that we have had on skill building, which is very add-on to one's profession, so there is a certain investment from the learners which comes, and we are able to buy in that kind of approach, and it is also taken seriously. So this approach of having service providers as our audience and also capacity building being one of the approaches is worked well. And we are also careful to not use explicit images because that would definitely put us under radar. So we are careful about it. And wherever there is information which is directed towards children below 18 years of age, we do have a disclaimer to say that this is an information only for educational purposes and not for sexual exploitation or abuse and so on. Being able to create a safe and inclusive space through our forums, or whether it is in social media platforms and so on, because we kind of reiterate this again and again to say that all of us would have different points of view. So we are here to assure you a non-judgmental space for us to have our conversations freely. Maintaining anonymity of the users is very necessary, and we that approach has really helped us in getting us trust from the users also. Some way forward, there is a lot of work to be done, but some way forward is that a collective learning space and co-creating content, because there is a fear that some of the content is being duplicated. I mean, are we creating content which is already existing and wasting our resources and energies? Instead of that, can we come together and create content and tap on each other's capabilities there, whether it is to do with visual, audio, or content and experience sharing and so on. This would be a wonderful way for us to take it forward in the digital space. And building communities, creating these networks is very important, and networks with teachers, educators, involving young people, the digital, the people who develop technologies, and other stakeholders. So it is very important that we are all able to network and then find a way forward to build more effective digital spaces, digital learning for sexuality education. Not just about, also the digital media should not just be about information dissemination, but also whether we are able to give information about SRH services, and that is a component that we can work on. And being relevant in the times and keeping in pace with both the emerging and evolving perspectives in sexuality, and also with the emerging technologies. That is something that we can keep in mind. Yeah. Are there any questions I would like to take?
Thank you, Ramya, for that. I think we have 15 minutes left, and thank you for your amazing presentation and all the incredibly informative and insightful points that you made. We have been collecting some of the questions that have been put in the chat, so we would encourage you. So if you have questions at this point, please put them in the chat so that we can address them all, and including the questions for Ramya's presentation. So if I may, I would like to first address one of the questions that was put in the chat for Paola. There was a question made by Jane Colvin regarding how CS has been delivering CSE through the use of digital technology. And I think just to quickly address that, Paola had indicated at the beginning of her presentation that they have been working through the Amaze platform, and I put that in the chat, but I will allow Paola the opportunity to maybe share some information about what they have been doing in terms of digital technology for delivery of CSE, and then we'll come back and address some other questions. But Paola, please go ahead. Paola, ¿me escuchas? Paola. Paola, ¿estás? ¿Me oyes? Okay. I see Paola is probably having technical issues, so perhaps we can move on to another question. And there were a number of questions to address to EVA, to Faithful. So Karen Mann made the question regarding data. She asked, what did you do with the data, e.g., do you look for trends in questions? Do you share any insights with decision makers, schools, and help advocacy for CSE? And there was another question for Faithful. I think she has addressed some of them in the chat regarding how does the application or the app refers users to healthcare services if needed. And there was an interesting question connecting with the comment that Faithful made about the girl thinking that she was dying because she was bleeding. So how are girls prepared for puberty in Nigeria, if this is the norm? And then the issue again on data and how youth in the rural areas access internet and what is their access to smartphones. So those are some of the questions addressed to you, Faithful. So you have the floor if you want to address them.
Okay, thank you very much. So I'll take the first question, what we did with data. So first of all, the back end of my question and answer service has a place where we would know how many questions you responded to, how many questions are responded to based on different thematic areas, because we cannot restrict the kind of questions that are coming from young people. So we have some questions that are non-reproductive in nature, and we have some questions that are reproductive in nature. We have questions on puberty, body changes, and based on, and we also have, location where people can put in their age, where they can put in their location, where they're calling from, so that when we now have, in cases where we've had maybe a particular question coming from a particular place, for example, there was a case where we had about 15 questions coming from a particular community in Abuja, in Nigeria here, reporting female genital mutilation. And so we went to the community to talk to the people about it. And what we did was to separate the young people from the elderly. And the elderly people said, never, not in our community. We don't do such. And then when we now asked the young people, they said, yes, I know so person that was caught. I know this person that was caught, and that kind of, so yes, the information we get, the data we get from the back end influences our interventions. Also, it intervenes the kinds of schools we go to. For example, last year we installed anonymous boxes in schools because we understand that students might not have access to phones. And so they drop in their questions in the boxes, and then the guidance and counselor, there was a committee that was formed, and they were trained extensively so that they can respond to these questions. And wherever they do not have answers, they now refer to us for support and help in order to tackle some of these questions. And it was a major shock for a lot of schools because they got questions that they never thought were in the minds of the students. So once you remove, their identity from the questions, it's very easy for young people to communicate. And yes, I think that answers the first question. So how are girls prepared for puberty in Nigeria? What's the norm? Sincerely, the norm is, it is your guardian that talks to you about it. However, these guardians do not even have accurate information about it, and some of them are shy, in quotes. They do not even know how to communicate with their children. So the girls are sometimes left to figure it out. And then when they get to schools, they have conversations among themselves. So the first person that starts breast development becomes the tutor of what to do, becomes the teacher of what is the norm, or what. And the first girl that menstruates is the one that other people go to me to say, okay, and see what's happening to me. But that's because she spoke out. There are people who are menstruating, and then they would keep it as if it's something that is bad, as if it's a plague, So mostly for the girls, it's their mother or a female figure, and it also influenced the decision or a project that we did to improve the access of adolescent girls to contraceptives. And what we did was to train elderly young women, not too elderly in their 50s, but people that were around 30, to be mentor mothers in communities, so that young people can go to meet them for information and access to accurate puberty information. Then is there data on how youth in the rural area access internet, and what is their access to smartphones? So in terms, it differs. For some people, their parents can afford, and based on the relationship that they have with their parents, they might be able to have access. Whereas there's some people who their parents might be able to afford, but because of the relationship, do not have access. There's some people who have good relationships with their parents, but their parents cannot afford a smartphone. So it's dynamic, it differs. Where would this research put? Are there any plans for the same? Yes, so let me give a brief example. For example, we just launched a new social media platform, which is Clubhouse, because we realized that young people were doing a lot there, and we started having conversations in Clubhouse. So when research are being put together, education as a vaccine is very big when ensuring that adolescent girls and young women reach their full potential. So we would go at any length to ensure that accurate information gets to them. When HIV, started in Nigeria, Education as a Vaccine was one of the first organizations that took the lead on ensuring that people living with HIV have accurate information. And we embarked on different interventions, including prevention, distribution of condoms, and ensuring that adolescent girls and young women have access to HIV testing. In Benue, which had the highest rate of HIV at the time, Education as a Vaccine set up a Ever Youth World in EVA where adolescents could walk in and get tested for HIV for free. And Ever Youth World is still in existence till today. Once anybody walks into the office, you can get tested for HIV. Although now we are moving to HIV self-testing, and EVA is also on the bus to ensuring that adolescents and young women get access to HIV self-testing. Thank you.
Thank you, Faithful. And it is one of the interesting aspects that both in your presentation and Ramia's presentation was clear is the issue of and thinking about CSW for next year is the issue of the need to advocate for member states to address the more structural aspects with regards to technology and access to digital technologies, particularly at the intersection of education, including CSE. So it is clear that this is also an issue in terms of how women and girls and gender diverse people have access to internet and to devices also. So this is structural and needs to be addressed to ensure the delivery of CSE through these platforms as well. So it is clear from that perspective. But I just wanted to bring back one of the questions that was in the chat box. So I don't know, Ramya, and sorry for putting you on the spot. So maybe you want to take it, but don't feel obligated to do so. Elaine Congress made the question regarding how in countries that have policies that discriminate against LGBTQ people, how does this affect the delivery of sexual education, comprehensive sexual education? So I don't know if you want to take that again, and then I will repeat the question. Paola is back, so we will repeat the question at the end after your answer. So please go ahead, Ramya, if you want to help us with this.
Thanks, Lisa. So how does CSE, so many sexuality education, I mean, a lot of people call it as sex ed also. Many times it just focuses on a non-heteronormative kind of where it's only focusing on heterosexual relationships or like genders, which is so binary and so on. That is quite prevalent, and that is where we need to break in to kind of be able to provide information. Yes, there is a lot of resistance when this comes, and as Paola was also mentioning, there is this idea of are your plans to make the young people gay? I mean, is that how it is? And so on. So resistance are, I think, similar wide across, but that would not mean that one should restrict oneself to only talk in binaries. It's very important to expand the identities of both gender and sexuality while having a sexuality education. I don't know whether I've answered your question, but yeah, we've been able to do that as Tarshi, that is one thing that we do that.
Thanks, Ramya. Yeah, and I think it was related to the context where LGBTQ people are discriminated against. So in restrictive context, how is CSE deliver? So I think that was the question. But maybe I don't know if Paola, do you want to also chip in or help us in understanding this? And also, let me switch to Spanish and apologies to everyone. para repetir la pregunta, que quizás nos puedes entonces también ayudar a entender cómo cómo se puede impartir educación sexual integral en contextos restrictivos donde hay discriminación en contra de grupos LGBTI. Y además había una pregunta específica para CIES sobre cómo implementan programas de educación sexual integral haciendo uso de la tecnología, y ya yo decía que tú habías señalado la experiencia de Amaze y pusimos los links a Amaze en el chat, pero quizá tú quieras responder a esto. Y bueno, nos quedan 2 minutos, así que si pudieras entonces en esos 2 minutos responder, te lo agradeceríamos mucho.
Sí, muchas gracias. Bueno, para nosotros es estratégico el trabajo con los actores principales y directos, que son los maestros y maestras, ¿no? Ellos son nuestros aliados. Gracias a ellos hemos entrado a las unidades educativas para que ellos implementen los procesos de educación integral en sexualidad y no CIES como tal, ¿no? Entonces, hemos desarrollado competencias, obviamente significa este proceso de formación, la sensibilización en estas temáticas para lograr este trabajo integral y para posicionar la importancia de la educación integral en sexualidad en el sistema educativo desde estos actores que son los principales dentro de la comunidad educativa. Bueno, y es importante la argumentación, por eso hemos trabajado en este documento, porque si ustedes han visto la presentación de género, no habla de LGBTIs, no habla de las diversidades en general, pero sí esa argumentación que hemos presentado, de hecho lleva a trabajar estos temas, pero nosotros hemos tenido que ir por el otro lado, ¿no? De no ir directamente con esta temática, pero creo que la argumentación es lo más importante para no generar estas barreras, ¿no? Por otro lado, nosotros como CIES sí trabajamos a nivel tecnológico. Durante la pandemia hemos tenido que desarrollar las capacidades, no solamente del plantel técnico de la institución, sino de jóvenes, de maestros y maestras, quienes son nuestros aliados para implementar estos procesos. A través de los proyectos y también con ingresos propios de la institución, hemos dado acceso a megas a los adolescentes para que puedan participar de las actividades virtuales. Hoy en día para los jóvenes ya no es un incentivo, un refrigerio, no sé, una polera. Para ellos un incentivo es contar con megas para poder participar de las diferentes actividades que tienen, tanto recreativas como de estudios, ¿no? Y bueno, hemos generado pues todo un sistema tecnológico a nivel de nuestras clínicas, de nuestras regionales, como llamamos, para que los adolescentes y jóvenes tengan acceso a tecnología. Y bueno, hemos adaptado nuestros contenidos para realizar procesos educativos virtuales, porque nosotros antes de la pandemia teníamos actividades de capacitación en educación integral en sexualidad meramente presenciales. Entonces realmente ha sido un reto para nosotros, pero sí tenemos contenidos para trabajar en educación integral de forma virtual.
Gracias, Paola. Thank you so much for that presentation, and indeed providing internet access. I don't know how to say that in English, megas, like free access to internet for adolescent and young people. It's certainly now an incentive to come to the training courses. That's a very interesting approach, and it's definitely something to think about. And as a lesson from your experience on the ground. And with this, we want to thank you all, Ramya, Paola, Faithful, for your incredible presentations, very insightful and very informative. We are very happy to have had this opportunity to discuss these issues in the context and in light of what's coming up next year, not only with CSW, which is going to be tackling the issue of technologies and education, but also CPD next year is also going to be tackling the issue of education. So comprehensive sexuality education both delivery through technology and digital solutions or digital interventions, and in general, in and outside schools. It's going to be an important aspect of our advocacy work next year. So we want to thank you all for staying with us until now, until this point in the meeting. And thank you to our presenters, and thank you, Huri, Devan, Ivy, and everyone at NGO CSW New York. You are amazing hosts, and we're very happy to share this space with you. And thank you to my colleague Shifra, who has been in the background helping us with putting together this event, and of course to the interpreters who made possible the interpretation for today's meeting. Thank you very much, and have a great day or evening.
Thank you, Louisa. I just wanted to end by saying thanks for your participations, and also to address a couple of questions. I know there were a few that we couldn't address. Winifred, I'm sorry. I guess I don't know if any of the speakers read your question and could answer it, but I also just want to highlight that we are, as I said before, and in the chat, we are going to try very hard to be more engaging. We'll next time we'll try breakout rooms. We'll try those boards that everybody can make comments. So please do stay in touch with us. First of all, I want to thank Louisa for doing such an amazing job moderating and for partnering in this month. And we look forward to seeing you all next month. And of course, look for all those emails that Devin sends out with the information. ARG, Ivy, again, just like Louisa said, thank you all. And last but not least, you know our habit, unmute yourselves. Let's hear everybody's voice while we say goodbye until next time.
Bye.
Bye.
Everyone, thank you.
Stay healthy.
Goodbye.
Bye.